You know, this marker behind us, yet to be unveiled, stands as a very powerful and stark reminder, not just of an important struggle in our past, but also as a testament to the power of courage. As many of you know, we came together 2 months ago to honor a group of individuals, men I consider true heroes, for their work to integrate Moses Cone and Wesley Long hospitals. We honored these men because in the early years of our operation as an organization, African American physicians and dentists were denied the opportunity to practice medicine in our facilities. We also barred African American patients from being admitted on the same terms as white patients. This was not right. I stand here today to once again applaud Dr. George Simkins, Dr. George Simkins Jr., Dr. Alvin Blunt Jr., Dr. Milton Barnes, and their colleagues for their efforts to right that wrong. This marker will help to ensure that future generations will remember them as well. During our recent event honoring these men, I also apologized for Cone Health's role in past racial discrimination. And I want to reiterate that apology today. As Edward Cone, a descendant of our founders and a current member of the Board of Trustees for Cone Health, shared in a letter that evening, and I quote, "For too many years after our doors opened in 1953, we failed to uphold our mission to serve our entire community. It is far too easy to look back on the laws and customs of the time and say, things were different then. Because some people stood up, the people we honor today stood up. We should have stood up." Dr. Blunt, Dr. Simkins, Dr. Barnes, and the other physicians and dentists who made a federal case out of what was happening in Greensboro were fighting for something larger than the particulars of their complaint. As the Fourth Circuit decision in their favor makes clear, segregated health care had far-reaching negative effects on wellness and quality of care for millions of people. As Dr. Martin Luther King Jr. said, "Of all the forms of inequality, injustice in health care is the most shocking and inhuman." All of us are better for the changes Dr. Simkins, Dr. Blunt, and so many others fought for, and we're grateful to those who helped make change possible. I thank Edward Cone for sharing these thoughts with us. Today's historical marker is another step in the right direction, ensuring that we'll never forget our past. It's essential that we remember all of our history, whether we're proud of it or not, so that we can make certain together to build a better future. We're a different and a better Cone Health today. We're committed to working toward an atmosphere of diversity and inclusion. We know that our organization is made stronger when we appreciate our different cultures, backgrounds, and beliefs, because we're then able to access different skills, different styles, different perspectives. 4 years ago, we created at Cone Health the Office of Inclusion and Health Equity, led by Paul Jeffrey, who's here with us today. Our intent and commitment is to eliminate disparities in healthcare across our integrated healthcare network. And although we cannot rewrite history, we can do our part to make our collective future better. It is in this vein that Cone Health announced that we will commit $250,000 in seed money for annual scholarships that will help worthy students pursue education in healthcare. We deeply thank the Greensboro Medical Society for agreeing to administer that scholarship, which we hope is a small step toward continued reconciliation. We know there's more work to be done. In the coming months and years, we will continue to challenge challenge ourselves and each other to become an organization that mirrors the communities we serve and that achieves equal health outcomes for all of those for whom we're privileged to care. Thank you very much.